Yeah, so we know that gastrointestinal symptoms are extremely common in women with endometriosis. They affect about three-quarters of sufferers. The symptoms can be things like abdominal pain, bloating, altered bowel habits, painful defecation, um, and they have a negative impact on women's daily life and their quality of life. They can lead to problems such as misdiagnosis with conditions such as IBS. They amplify the pain experience, and there's that detrimental impact on quality of life. Yeah, so we knew from our research that a low FODMAP diet is really effective in irritable bowel syndrome. And there's a lot of evidence in that field to support the use of a low FODMAP diet. It's recommended as a first-line therapy in clinical guidelines. Um, but by contrast, in women with endometriosis, we know these gut symptoms are really common, but there are really very few, if any, evidence-based treatment options for managing those gut symptoms. A lot of women will use a dietary approach in an attempt to manage their endometriosis generally and or their gut symptoms. But again, there's no evidence to show really that any particular dietary supplement or dietary approach is effective. So, given the overlapping symptoms between endometriosis and IBS, we conducted this randomized control trial where we measured the efficacy of a low FODMAP diet in women with endometriosis and poorly controlled gut symptoms. So, it was a dietary feeding study. So, we enrolled 35 women with endometriosis, poorly controlled gut symptoms. They were randomized to either a supplied low FODMAP diet or a supplied diet that was nutritionally equivalent to the low FODMAP diet. It just the only difference between the two diets was that one was low in FODMAPs and one was not. That was our control diet. Um, Participants consumed the diet for 28 days before crossing over to the alternate dietary intervention, so either low FODMAP or control. And at the end of the treatment period, we saw significant differences. So on the low FODMAP diet, women experienced less severe gastrointestinal symptoms overall. 60% responded to the low FODMAP diet and experienced clinically significant improvements in their gut symptoms. We saw improvements for abdominal pain, bloating, stool form, so fewer loose stools, and also improvements in quality of life on the low FODMAP diet. And we saw those improvements after 2 weeks on the low FODMAP diet. So it took about 2 weeks until there was a clinically and statistically significant improvement in gut symptoms on the low FODMAP diet. And those improvements continued until for the end of the 4-week intervention. Well, they offer, previously there's been very little evidence to show that dietary approaches work in endometriosis. So women will restrict their diet. They're often restrictive approaches that women will follow to help to manage their symptoms. Might be excluding dairy, gluten, red meat. But we didn't have previously any evidence to show that those diet therapies work. So in our study, we've got the evidence now to show that there is an evidence-based dietary approach that can help to relieve gut symptoms in women with endometriosis. Yeah, I suppose it's important that women, follow the diet in consultation with a dietitian. So, yeah, the diet's intended as a three-step diet. So they initially reduce their FODMAP intake for a period of 2 to 6 weeks, and then they work with a dietitian to work out which FODMAPs trigger their gut symptoms and which don't. And then over the longer term, they they reintroduce well-tolerated FODMAPs and only restricts those that contribute to symptoms. So working with a dietitian is really important in if women are to follow this diet. It's also really important that in the first instance, other causes of gut symptoms are ruled out before they proceed with following a FODMAP diet. So there can be other factors contributing to gut symptoms. We think that endometriosis probably contributes to these gut symptoms, since they're so common in this group, affecting 3/4 of women with endometriosis. But there can be other causes of gut symptoms, such as celiac disease or inflammatory bowel disease. It's important that other causes of gut symptoms are ruled out before women follow a FODMAP diet, and that can be done with a referral to a gastroenterologist to look for other causes of gut symptoms. But if appropriate, the FODMAP diet can be prescribed, and that should be followed in consultation with a dietitian.